Neglected genital hygiene invites severe, escalating bacterial infections that can impact your health for years. The pelvic region is a specialized environment that traps body heat and holds moisture. This creates a highly effective incubator for rapid bacterial buildup. When these bacterial colonies persist, they trigger chronic inflammation of the sensitive genital tissues, a process that compounds as it continues over decades. This chart maps the specific biological progression. It begins with moisture-trapping bacteria triggering persistent inflammation. Over years, this chronic immune response damages sensitive tissues, eventually increasing the statistical risk for rare complications like penile cancer. To break this inflammatory cycle, you need a definitive, scientifically grounded daily routine. The prerequisites for this routine are straightforward: a mild soap, clean running water, and breathable undergarments. Treating your genital hygiene as a precise medical protocol is a necessary frontline defense for your long-term health. A common failure point in male hygiene is the use of heavily scented, chemically aggressive body washes on highly sensitive skin. Look at this comparison. On the right, those harsh chemicals strip natural oils, leading to severe dryness and localized itching. You need what is on the left, a plain, mild, fragrance-free soap. This washing protocol must be executed every single day to prevent microbial colonization. Clean these 4 primary zones daily: the penis, scrotum, inner thighs, and anal region. Within those, target 3 high-risk microzones where moisture pools: beneath the penis, under the testicles, and deep in the thigh creases. Actively targeting these exact anatomical moisture traps is required to effectively neutralize the bacterial threat. For uncircumcised anatomy, the enclosed environment directly beneath the foreskin is unequivocally the single most vulnerable point for bacterial compounding. This specific area naturally produces a biological byproduct called smegma, a naturally occurring accumulation of shed dead skin cells and oils. If this material is allowed to remain, it causes a noxious odor and tissue irritation, and a high likelihood of localized bacterial or fungal infections. The extraction protocol. Step 1. Gently retract the foreskin. Step 2. Rinse thoroughly with clean, running water. Step 3. Lightly agitate with bare fingers. Do not aggressively scrub or use washcloths, preventing microabrasions. Finally, dry completely and return the foreskin to its protective position. This gentle, consistent daily routine is the absolute best preventative measure against painful and recurring infections. Outside of the shower, the secondary danger zone is daily post-bathroom moisture management. After urinating, use a gentle shake to expel residual drops. This prevents slow leakage into your underwear throughout the day. After a bowel movement, clean thoroughly to ensure zero residue remains. Microscopic fecal matter causes intense localized itching and the spread of bacteria. Always wash your hands immediately after. This prevents the introduction of outside pathogens to the sensitive genital region. When you finish bathing, you must dry the groin completely before dressing. If you are particularly prone to heavy sweating, actively applying a light drying powder can help maintain a dry environment. The fabrics you choose dictate the local climate. Tight, synthetic materials act as a non-permeable barrier, trapping radiant body heat and sweat against the skin. Loose-fitting, breathable cotton is the better choice. Its open weave promotes active airflow and moisture evaporation. A perfect shower routine is negated if the body is immediately locked into a hot, damp, synthetic environment for the subsequent 12 hours. Following this daily protocol consistently removes the primary triggers for discomfort, odor, and long-term bacterial colonization. However, hygiene cannot cure structural or pathological diseases. You must monitor for specific medical red flags. See a doctor if you observe a sore that refuses to heal, any unusual physical growth or lesion, or persistent unexplained redness or pain. Early detection and immediate clinical treatment of these specific anomalies drastically improve long-term medical outcomes. Mastering this physical protocol is a critical daily commitment to preserving your long-term biological health.